Here we present our paper, Data Subjects' Conceptualizations of and Attitudes Toward Automatic Emotion Recognition-Enabled Wellbeing Interventions on Social Media. I'm Kat Roemmich, a PhD student at the University of Michigan School of Information. My co-author and advisor is Dr. Nazanin Andalibi. Emotion recognition refers to computational methods that infer and sometimes interact with humans' emotional and affective states. The processing and handling of emotion inferences enabled by emotion recognition is an active research area in our CSCW community, as well as a rapidly growing global market economy. One particularly rich source of personal data from which emotion inferences can be made is on social media, where people connect with each other in personal and often emotional ways. We share stories of heartbreak and loss, photos of our happiest moments, and angry rants of our life's frustrations. In this context, emotion recognition may be used not only to generate inferences of an emotion, but to respond to them, such as an automatic intervention on social media designed to enhance an individual's well-being. This is a context in which emotion recognition is being developed and explored. There is renewed and increasing attention to emotion recognition and well-being interventions on social media, in both scholarship and public opinion. Social media has been at the forefront of well-being and technology discourse, as some of these news headlines show. Yet, emotion recognition-enabled applications are often designed, developed, and deployed without active participation with or meaningful consent of data subjects. The targets of these systems, the individuals that generate the data that make these applications possible, and those potentially affected by their interactions with these systems. Indeed, we know very little about the perceptions of data subjects regarding emotion recognition applications, how they conceptualize them, what attitudes they have, how they think they might be beneficial, and how they could harm. Our work explores these questions in the context of social media well-being interventions. How data subjects think about automatic emotion recognition-enabled well-being interventions on social media. We conducted a scenario-based interview study with adults in the U.S. who indicated in a pre-screening survey that they use social media to share emotional content. We explored their perceptions in depth during the interviews and analyzed transcript data using inductive approaches. In this paper, we contribute how data subjects think about automatic emotion recognition-enabled well-being interventions on social media, their attitudes toward them, how they conceptualize them, and the qualities upon which their attitudes depend. Overall, we find that people have predominantly negative attitudes toward automatic emotion recognition-enabled well-being interventions on social media. Participants were concerned about the risks automatic well-being interventions on social media present to society, such as in spreading misinformation, as well as risks to individuals, such as harming vulnerable people. Additionally, participants were concerned about the power imbalance between social media platforms and their users. Participants emphasized a need for individual and external controls to address their concerns. We identified two sets of factors that shape people's attitudes toward automatic emotion recognition-enabled well-being interventions on social media, based on their conceptualizations of the interventions, as well as qualities they identified trustworthy ones should have if implemented. On the first, we find that attitudes are largely influenced by how people compare their conceptualization of automatic emotion recognition-enabled well-being interventions to the humans that traditionally provide supportive care. Additionally, we identify qualities in the development and delivery of automatic emotion recognition-enabled well-being interventions upon which data subjects' attitudes depended. For time's sake, we'll focus today's presentation on the factors that shape data subjects' attitudes, their conceptualizations of automatic emotion recognition-enabled well-being interventions on social media, and the qualities they identified that trustworthy ones should have if implemented. We encourage you to check out our paper for further detail, which we've linked at the end of the presentation. Let's begin by discussing data subjects' conceptualizations. When participants conceptualized automatic emotion recognition-enabled well-being interventions on social media, they instinctively compared them to care workers, the humans that traditionally provide care to support and intervene in their well-being, family and friends, personal networks, mental health care providers, and a dichotomous human versus AI conceptualization. In our analysis, we identified 4 attributes that data subjects feel are essential to caring and supportive well-being interventions, attributes that are essentially human. The first attribute we identify as essential to supportive well-being interventions is helpfulness and authentic care. Participants felt that the support delivered by caring human professionals was genuine, and that automatic emotion recognition-enabled well-being interventions were impersonal and unhelpful. On this, participant 5 notes, the algorithm is not out there out of any form of interpersonal care, even if it's been put out there by a human being. I don't know if I could ever envision a world in which it was put out there to genuinely help people. The second attribute that we identify is personal and professional expertise. Participants felt that automatic emotion recognition-enabled well-being interventions couldn't compare to the humans that already offer the support, trained professionals, their communities, and personal networks. They couldn't trust automatic interventions due to their lack of expertise and personal experience. Participant 3 said of mental health professionals that they also have a certain amount of community attached. I don't feel like an AI could get there. You, in the end, will still rather call a friend and talk about it. The third essential attribute we identify is morality. Participants were skeptical regarding the financial motivations of social media platforms implementing automatic emotion recognition-enabled well-being interventions. They were cynical that social media companies would have moral intentions and did not want their emotions commodified or capitalized upon. Participant 9 illustrates, it could make us feel nice, I guess, but if they are going to sell us a product, I think that would change how we view and see them. It's not our family, our friends, so it's not genuine care. It's just trying to sell you something. Lastly, the fourth and primary attribute we identify as essential to supportive well-being interventions is benevolence through shared humanity. Participants felt that interventions by their human networks of care were benevolent, while automatic emotion recognition-enabled well-being interventions were intrusive and creepy with suspect intentions. Participant 3 notes, but an algorithm is a thing. It isn't similar to you in the way that you both have a shared humanity. It's more of a thing, and that makes me uneasy, because that means that thing in the wrong hands can do a lot of damage. It's not a person. In the end, humanity is perceived as a primary and essential attribute of supportive well-being interventions, an attribute that data subjects feel automatic emotion recognition-enabled well-being interventions inherently cannot hold. Consequently, their attitudes toward them are shaped in a negative way. Participants felt that automatic, algorithmic methods of delivering well-being support would neither be welcomed nor helpful due to the essentially human attributes that they lack. We now discuss the second set of factors that shape data subjects' attitudes, based on qualities of the intervention. We identify 3 qualities that data subjects require to consider automatic emotion recognition-enabled well-being interventions on social media trustworthy, qualities upon which their attitudes toward them depend. We argue that ethical and trustworthy emotion recognition applications should be developed and delivered in ways that support the needs, concerns, and requirements of data subjects, those that enable and are potentially affected by them. The 3 qualities upon which attitudes toward automatic emotion recognition-enabled well-being interventions depend are accuracy, contextual sensitivity, and positive outcome. If these qualities were implemented, some individuals might welcome automatic emotion recognition-enabled well-being interventions on social media. It's important to note that because these qualities are dependent upon individual preferences, highly nuanced and multifaceted preferences unique to specific contexts, that these requirements warrant an imperative for social media intervention designs that allow for more user control over whether and how they are applied. For example, regarding contextual sensitivity, participants felt that automatic emotion recognition-enabled well-being interventions might be more trustworthy if they were sensitive to specific contexts and individual preferences. For instance, some emphasized they might be okay with some types of well-being-related inferences and interventions, though others, such as those related to mental health, were unacceptable. Participant 7 illustrates, let's say I have some rare medical condition and it shows me an ad for a clinical trial in my area that could save my life. Maybe it's such a stigma, but if it's a mental health thing, that seems more slimy to me, that they're taking advantage of me. Our findings indicate that currently deployed automatic emotion recognition-enabled well-being interventions on social media are incompatible with goals to design and implement ethical, responsible, and socially aware AI. Data subjects' perceived risks regarding automatic emotion recognition-enabled well-being interventions are nuanced and complex. We emphasize the need for more robust privacy controls that provide data subjects more transparency and agency over whether and how they are subject to social media interventions, as well as explorations of alternatives to notice and choice privacy notices that inadequately obtain meaningful consent to collect, process, share, and respond to data subjects' emotion data. We explore their perceptions in depth in our paper and linked here, and we encourage you to check it out. Thank you.